Welcome to District Endocrine. This is your Dr. Rahman. I'm an endocrinologist, and today we are going to talk about how to treat Hashimoto's disease. Hashimoto's disease treatment may include either observation or thyroid replacement with different medications. Now, your doctor will decide based on overall clinical and the lab data they have. In terms of the synthetic hormone replacement, Hashimoto's hypothyroidism is treated with thyroid replacement. It includes most commonly prescribed generic synthetic thyroid hormone called levothyroxine, or brand names such as Levoxyl, Synthroid, or Unithyroid, as given in the US. Now, synthetic hormone is identical to the naturally made thyroid in your body. The thyroxine T4, that is the main component. This is a very inexpensive drug, and it's easily available across the pharmacies in the US. Monitoring your levels is also important thing. When your doctor writes you thyroid medication, your thyroid levels should be checked in 4 to 6 weeks, and then once your thyroid levels are optimized, it can be checked every 6 to 12 months basically. Over-treatment of thyroid can lead to a lot of problems. Now, for example, it can lead to bone loss such as in osteoporosis. It can lead to weight loss and rhythm disorders such as arrhythmias, AFib, atrial fibrillation. Please note that American Thyroid Association recommends against the over-treatment of thyroid replacement for weight loss. This is not a weight loss drug. Usually patients will need lifelong thyroid replacement. If the levels are normalized, you will even need to take your thyroid medications. Levothyroxine does not cause side effects as such when appropriately dosed. Over time, your dose may need to be tweaked. Weight changes have an effect on the thyroid dose requirement as well. One important thing I would like to mention is to avoid taking biotin when you are on thyroid medication, as it can interfere with your thyroid labs, and that can lead to over or under treatment. How to take thyroid medications correctly. Empty stomach, better in the morning, take it with plain water, avoid coffee or other drinks or milk. Do not mix it with other medications. Wait for at least 45 minutes before you start having your meal or early morning food, or a snack basically. There are several medications that can interfere with thyroid absorption. Now, heartburn medications are notorious, such as PPI, omeprazole, pantoprazole, and the list goes on. Calcium and ammonium containing supplements such as Tums or certain kind of antacids. These are all those medications that are gonna decrease your thyroid absorption. Now, patients who are taking cholestyramine, this is a cholesterol lowering medication that has known to have an impact on the thyroid hormone. If you are on these medications and you have to take them, try to take them in the afternoon or in the evening, or at least wait 4 hours after you have taken your thyroid medication so that it does not interfere with your thyroid supplement. Levothyroxine is a synthetic version of thyroxine T4, which is converted to T3 as needed basis in the body. Some patients may not have their symptoms resolved with just taking T4 supplements, and they may benefit from cytomel, liothyronine T3 component. Now, there is ongoing research and the benefits are limited. T3 replacement can increase heart rate, anxiety, and sleep disturbances. Too much treatment with T3 can have a very negative impact on your heart and cause a lot of complications. Well, levothyroxine is standard of care, standard treatment for Hashimoto's disease. However, combination therapy such as T3, T4 with Armour thyroid or Nature thyroid is also used in selected patients. Some physicians have safety concerns regarding these formulations as the beneficial literature is limited. However, if used by an experienced physician under certain selected patients population, when appropriately monitored, Armour thyroid or Nature thyroid effectively improves hypothyroid symptoms and the quality of life in those patients who are unable to get that benefit from just T4 treatment, such as from the levothyroxine. Thyroid vitamin supplements are over-the-counter thyroid supplements to help your thyroid. It is strongly recommended to avoid such supplements as the thyroid quality as the thyroid quantity may not be standardized, and it can lead to under and over treatment and higher level of the thyroid in your body, and that puts you on a higher risk of complications from either low or the high level of the thyroid, depending on how much you get in the end. Well, that was the wrap up for Hashimoto's disease or hypothyroid disease, its treatment options, and thank you so much for watching, and we look forward to seeing you for our other videos.